If you're over 60 and you've been told that walking is the best exercise for your health, you're not alone. For decades, walking has been promoted as the safest and simplest way to stay active as we age. But what if I told you there is one chair exercise that can actually be more effective than walking, especially for people over 60, and it's surgeon approved? Hello, I'm Dr. Mira Tan, and today I want to share something that has surprised many of my patients. This is not a trend, not a gimmick, and definitely not a replacement for all movement. But for seniors who struggle with walking, joint pain, balance issues, or fatigue, this single chair-based exercise can deliver incredible benefits safely. As we age, our bodies change in very specific ways. Muscle mass naturally decreases, joints become stiffer, balance weakens, and recovery takes longer. Walking, while helpful, often fails to address these deeper issues. In fact, for some people over 60, long walks can actually increase knee pain, hip discomfort, or lower back strain. Many of my patients tell me, "Doctor, I know walking is good for me, but it hurts." This is where chair-based movement becomes powerful. The exercise I'm talking about focuses on controlled muscle activation, joint lubrication, and circulation improvement, all while keeping you seated. When done correctly, it engages major muscle groups in the legs, core, and upper body without the repetitive impact that walking places on your joints. That means less pain, less risk of falling, and more consistency. Consistency is the real secret to health after 60. An exercise that you can do every day, even on low-energy days, will always outperform an exercise you avoid because it feels hard or uncomfortable. A chair provides stability, it removes fear, and it allows you to focus on form and breathing rather than balance. From a surgical and medical perspective, this matters a lot. I've seen patients delay joint replacements, improve circulation, and even reduce blood sugar levels simply by committing to the right low-impact movements. This chair exercise stimulates blood flow to the lower extremities, which is critical for heart health, nerve function, and muscle strength as we age. Another key benefit is muscle preservation. Walking is primarily a forward motion activity. It doesn't fully activate all the muscles that protect your knees, hips, and spine. The chair exercise, I'll explain, works muscles through a fuller range of motion, helping maintain strength that prevents falls and supports independence. Now, I want to be very clear. Walking is not bad, but it is not always the best option for everyone over 60. Your body deserves an approach that matches its current needs, not advice designed for younger bodies. In the next part, I'll reveal exactly what this chair exercise is, how to perform it safely at home, and why so many seniors feel stronger within just a few weeks. Now, let's talk about the exercise itself and why it's making such a difference for people over 60. The movement is called a seated leg lift and press, and while the name sounds simple, its impact on the aging body is anything but small. Here's why surgeons and physical specialists recommend it. This single exercise combines strength training, circulation enhancement, joint mobility, and balance support, all while you remain safely seated. To begin, sit on a sturdy chair with your feet flat on the floor, hip-width apart. Your back should be straight but relaxed, and your hands can rest lightly on the sides of the chair. Take a slow, deep breath in through your nose. As you exhale, lift one leg forward until it is parallel to the floor, or as high as feels comfortable. Hold it there for 2 seconds, gently tightening the thigh muscles, then slowly lower it back down. Repeat on the other side. That's it. Simple, but powerful. What makes this exercise more effective than walking for many seniors is muscle engagement. Walking relies heavily on momentum. This movement forces your muscles to do the work. The quadriceps, hamstrings, hip flexors, and even your core activate to stabilize your body. Over time, these are the very muscles that protect your knees and hips when you stand, climb stairs, or get out of bed. Another critical benefit is joint nourishment. When you lift and lower your leg in a slow, controlled way, you help circulate synovial fluid inside the knee and hip joints. This natural lubrication reduces stiffness and discomfort, something walking alone often fails to do, especially for arthritic joints. Breathing also plays a key role. Coordinating your breath with movement improves oxygen delivery and reduces blood pressure spikes. Many of my patients report feeling calmer and more energized after just 5 minutes of this exercise. That's because it activates the parasympathetic nervous system, the part responsible for rest, repair, and healing. From a safety standpoint, this exercise significantly lowers fall risk. Falls are one of the leading causes of injury after 60, and fear of falling often prevents people from staying active. Because you're seated, there's no fear. Confidence builds, and confidence leads to consistency. I typically recommend starting with 10 repetitions per leg, once or twice a day. As strength improves, you can add a light ankle weight or extend the hold to 3 or 4 seconds. No gym, no equipment, no pressure on your joints. Perhaps the most important benefit is independence. Strong legs mean standing up without assistance, walking with stability, and maintaining freedom in daily life. I've seen patients who struggle to walk a block regain confidence simply by committing to this one-chair exercise. In Chapter 2, we'll go deeper. I'll explain how this exercise improves heart health, supports blood sugar control, and how to build a simple daily routine around it, without overexertion. At this point, you might be wondering how a simple chair exercise could possibly impact things like heart health, blood sugar, and long-term vitality. The answer lies in how the aging body responds to regular, low-impact muscle activation, especially when it's done consistently and without pain. When we think about heart health, we often imagine intense cardio, brisk walking, cycling, or long sessions on a treadmill. But for adults over 60, the heart doesn't need intensity as much as it needs rhythm and circulation. The seated leg lift and press creates a gentle pumping action in the lower body, helping push blood back toward the heart. This improves circulation without placing stress on the joints or spiking heart rate dangerously. Every time you lift your leg and slowly lower it, your calf and thigh muscles contract and relax. These muscles act like a secondary heart, assisting blood flow and reducing pooling in the legs. This is especially important for seniors who experience swelling, cold feet, or numbness. Better circulation means better oxygen delivery, not just to muscles, but to vital organs as well. Now, let's talk about blood sugar. Large muscle groups, like those in the legs, play a major role in how the body uses glucose. When these muscles are activated, they absorb glucose from the bloodstream more efficiently. That means even short sessions of this chair exercise can help stabilize blood sugar levels, particularly important for people managing prediabetes or type 2 diabetes. Unlike walking, which many people stop when pain or fatigue sets in, this exercise encourages longer-term adherence. 5 minutes after breakfast, 5 minutes after dinner. Those small sessions add up. From a medical standpoint, frequent, manageable movement is far more effective than occasional intense exercise. There's also a neurological benefit. Controlled, slow movements strengthen the brain-body connection. This improves coordination and reaction time, both of which decline with age and increase fall risk. By consciously lifting, holding, and lowering the leg, you train the nervous system to send clearer signals to the muscles. This is something walking on autopilot simply doesn't do. Another overlooked factor is posture and core engagement. While seated, maintaining an upright posture activates deep core muscles that support the spine. Stronger core muscles reduce lower back pain and improve balance when standing or walking. Many seniors unknowingly weaken these muscles because they rely too much on chairs and supports. This exercise helps reverse that trend safely. I've seen patients who couldn't walk for long periods due to arthritis, heart concerns, or recovery from surgery still make measurable improvements in endurance, strength, and confidence using this method. Their blood pressure readings improved. Their energy increased. And most importantly, they felt capable again. In the final part, I'll show you how to turn this exercise into a complete daily routine. How often to do it, what mistakes to avoid, and who should be cautious before starting. Now let's bring everything together and turn this simple chair exercise into a safe, effective daily habit that supports your health long term. The goal here is not to push harder, it's to move smarter, especially after 60. First, let's talk about how often you should do this exercise. For most people, once or twice a day is ideal. Morning sessions help wake up the joints, improve circulation, and reduce stiffness. Evening sessions can relieve tension, lower blood pressure, and improve sleep quality. Each session only needs to last 5 to 10 minutes. Remember, consistency beats intensity every time. Next, let's address common mistakes. The biggest one is rushing. This exercise works because of slow, controlled movement. Lifting the leg too quickly or dropping it down removes the muscle engagement and increases strain. Another mistake is leaning back or gripping the chair tightly. Your upper body should stay relaxed and upright, allowing your core to naturally support the movement. Breathing is another critical factor. Never hold your breath. Inhale gently before the lift and exhale as you raise your leg. Proper breathing keeps your heart rate steady and prevents dizziness, something especially important for older adults. Now, who should be cautious? If you've had recent surgery, severe joint instability, or uncontrolled heart conditions, always consult your doctor before starting any new exercise, even a seated one. Mild discomfort is normal at first, but sharp pain is not. Listen to your body. Progress should feel empowering, not exhausting. To build a complete routine, you can pair this exercise with simple seated movements like ankle circles, gentle arm raises, or neck rolls. Together, these movements support full body mobility without overwhelming your system. But even if you do nothing else, this single chair exercise can be enough to maintain strength and circulation when done consistently. What I want you to understand most is this: aging does not mean decline, it means adaptation. Your body is incredibly responsive when you give it the right kind of stimulus. You don't need long walks that hurt your knees or workouts that leave you sore for days. You need movements that respect your joints, strengthen your muscles, and fit into your daily life. Many of my patients tell me they feel stronger after just 2 to 3 weeks. Standing up becomes easier. Stairs feel less intimidating. Walking, when they do choose to walk, feels more stable and confident. That's the real power of this exercise. It supports everything else you do. If you're over 60 or caring for someone who is, I encourage you to try this for yourself. Start slow, stay consistent, and give your body the chance to rebuild strength safely. Thank you for trusting me with your time. If you found this helpful, share it with someone who needs a safer way to stay active. And remember, the best exercise is the one you can do every day.